Perhaps the prevention of loops.
It's a good one. Prevention of loop formation. Is that possible, Joe?
I think it is in about 70% of cases, David. So we will give you that as a challenge, Hannes. And to do that, you're going to have to do a lot of pleating. Okay? Do you understand the concept of pleating?
Yeah, I think so, yes.
You think so? Shall we give it a go?
Yes, we will. Okay.
So importantly, Hannes, if we're going to try and not form a loop, you have to recognize as soon as there's a deflection on the tip that you're going to have to do something differently. So the difference to pleat the loop and stop the loop from forming is we have to do things really early. So we're going to start by preventing loops right from now. So the way we do that is we just, as you're doing, decide where the lumen is and move the tip just a small amount to move the fold out of the way. Great. Fabulous. So just stop. The lumen is to the right, yes?
Yes.
Does it feel natural to rotate the scope clockwise, or do you want to use your right wheel?
I would I wouldn't rotate. I wouldn't use the wheel now.
Okay, so what I want you to do before you do that, as you're moving the wheel, I want you to pull back on the scope so you disengage from the mucosa slightly and just move the wheel a little bit. Okay, that's great. Lift the fold up. So you need to rotate it. Yeah. Good, good. That's excellent. Okay. And the same again. Lift the fold up. Now we're just going to push in a very small amount, Hannes, to pick up the next fold, and you're going to big deflection of the tip, and you're going to pull back. Pull back, pull back, pull back. Stop. Engage the next fold. Put some fluid in if it helps. You can see the mucosa spinning. Very good, Hannes. Slow, slow now. Slow, suck, suck, suck. And then I want you to just rotate a little bit clockwise and bring the tip up and engage the next fold. Lift the tip up.
I have the feeling I have to pull back first a bit.
So you try pulling back and tell me what happens.
The image is stable.
Yeah. So if
now the image is coming back as well.
Okay, so now you've got good one-to-one. So just push in really slowly, Hannes, and then guide the tip as you do that so you don't crash into the mucosa. Okay, so stop at the fold and use the tip rather than pushing the scope in any further. Use the tip. Tip up, tip, and then clockwise torque a little bit and pull back at the same time. Clockwise, clockwise, clockwise. Good. Slowly, 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 and pull back so you're not against the mucosa. Lovely. Stop. Just let the colon settle on the colon settle on the instrument. You're just pleating it. A little bit of water and a small movement of the tip. Fabulous. Just stop for a second, Hannes, and just look at the image and tell me what you see.
I think it's possible. We're not that straight with the scope. So I think it's something we have to look out for.
I know we've got the imager to look at. How did we use the imager in your training?
I think when we saw the splenic flexure bending, widening, I think it was very useful to do the anti-clockwise torque maneuver by straightening it out. It's a bit reassuring for me as well in the left column when I tried to pull back that I saw the scope really straightening. So that was a very useful feedback as well. Most of the time when you ask me to do a maneuver, I felt like it was really the thing I wanted to do as well. So that was very useful as well, actually, because otherwise I'm just used to do what I think I have to do, but I don't know if it's the right thing. So the feedback you gave me all the time was for me very useful. And especially the anti-clockwise torque at the splenic flexure.
So Hannes, that's great credit to yourself, because one of your goals was to try and avoid a loop, and we do that by pleating. And so most of my advice was to try and get you to pleat early, pleat early, pleat early. And by doing that, you will start to form a little bit of a loop, but then you resolve it, a little bit of a loop, and then you resolve it. And I think a credit to yourself, this patient will have had a long sigmoid mesentery. So that sigmoid is going to be very, very long, and it'll be very easy to form a big loop in there. And you didn't. You did form a bit of a loop, but we managed to pull it all out. And I thought you did that remarkably well by, as I say, going beyond the fold and pleating the colon by straightening it. And then, as you did towards the end of that, when we reached the sigmoid descending junction, it was a combination of pleat and torque steer. And to do that, you have to have good control with your left hand. And then after that, it's the technical exercise, which we've just discussed, which, as I say, is this pleating and reducing the colon. But it was a pleasure to teach you, Hannes, because despite the fact you've not used the imager, I thought you picked that up really quickly. I think you're right. The lesson about the splenic flexure moving posteriorly is a really important one, and maybe not so much for this case, but I will guarantee over the next 7 days, if you're doing any colonoscopy, if you remember that as you're approaching the hepatic flexure, you will find that anti-clockwise torque will help drive the instrument forward. And equally, if you're above the cecal pole and you want to advance down into the cecal pole, often applying a little bit of anti-clockwise torque on an insertion will help you do that as well. So that's a really important thing for you to pick up on. Yeah?
Yeah, thank you very much.